All right, so let's get started for today. So we wanted to do a couple of things. We didn't meet that long ago, but we wanted to come back and do a touch base after the advisory committee had a meeting. So today I'm going to walk you through sort of the process we did at the advisory committee in January. I think it was January 22nd, 23rd, somewhere in there, 22nd. And then talk about sort of where they see us heading in terms of the community safety and wellbeing plan. And then I wanted to spend some time having a discussion around how you want to move forward with actually building the plan. So that's what we're going to spend a bunch of time talking about today. So just a reminder to get you back thinking about the plan. So if you remember at our last meeting, we had a discussion around the length of time for the plan. So you decided that it would be a 3-year plan, focusing both on short-term initiatives, so things that could be done fairly quickly, as well as some of those longer-term initiatives, so things where we may start working on them now, but they may run longer than the 3 years of the plan, that we would focus both on sort of risk and protective factors. And just a reminder again that the plan needs to be approved through all of the municipal councils by July 1st, 2021. So what I'm going to have to do is I'll work with each of the CAOs. We'll have to do a mapping out of council dates because we want to make sure we get into the right cycle to get the report into each municipal council for approval prior to that July 1st deadline. So it's just a little reminder about the plan. So let's take a look at the advisory committee. So the advisory committee met on January 22nd. We had more than 40 people attend the session. And what they did is they did the same thing I walked you through. So I walked them through the overall responses to the general public survey. And then we went through all of the top rated elements for the community safety and wellbeing plan. And they reflected on those 3 questions that you see on the screen. So really what I wanted to get that group to do is by the end of the session to give us a sense of what areas they'd like to see focused on in the community safety and wellbeing plan. So this slide shows you the results comparatively across some different groups. So on the far left, based on the general public online survey, the top elements that they picked or selected for higher priority in the plan were the 6. So mental health, education, skills development, substance use and addiction, criminal activity, housing security, and employment. Then, if you recall, we also did a community partner survey last fall, and their top 6 are on the screen as well. You will see I've color coded so you can see mental health issues, both in the general public community partner, substance use and addiction, housing security, stuff sort of around economy, education, employment, sort of overlap between those 2 lists. So the advisory committee, after their look at the general public survey, as well as looking at the discussion they had around the community partner survey and the data package, have provided this top 6 list as areas they think should be focused on in the Elmer Elgin St. Thomas Community Safety and Wellbeing Plan. So they're suggesting that we focus on mental health and well-being, housing security, substance use and addiction, education and skills development, internet access, and digital literacy. So those are the top pieces that we're seeing from the advisory committee. So I want to just stop and get your sense of those in terms of moving forward, whether you think they're a good reflection of sort of all of the pieces of the puzzle we've looked at so far, sort of how you're feeling about it. So take yourself off mute. How do you feel about sort of that top 6 list? So they would be, if you decide to go forward, they would be sort of the high level priorities, and then we would drill into them to say what would be the focus in each of those areas over the next 3 years, knowing that it's a 3-year plan. So what are your thoughts about those? It's sort of the top 6 list. I do have one comment could be digital literacy could fit under education and skills development as sort of a sub-theme, because literacy to me would fit sort of with lifelong learning and education. So if you wanted to collapse one, that could be an opportunity to sort of tuck that one underneath your education and skills development. how are you feeling about that list? Zonk, what do you think?
Well, I'm looking at the internet access. I agree with 1, 2, 3, and 4. I'm not too sure about number 5 and 6. Number 5 specifically, internet access. That isn't something that the community as a whole can implement, or I mean that's. I mean, if you don't have internet access, you don't have internet access, and if the provider doesn't have the service there, how are we as a community supposed to implement that or even work on it? I just don't see that as something that should be taken on by this particular group or by this particular plan.
So I can give you a, so I worked with Middlesex yesterday and did their advisory committee as well. What their advisory committee decided to do, instead of having internet access as a standalone priority, they're going to look at it as a lens that they will apply to all of their top priorities, and not internet access, but virtual access to services. So knowing, I mean, the pandemic has certainly highlighted that as an issue and a challenge in rural areas. And sort of going forward, especially in rural areas where you don't have access to physical or in-person programs and services, that virtual access piece is important. So that could be another way, if you don't want it in your top list of priorities, that we could put it as sort of a lens for each of the priorities to look at. What do you think, Mary?
And same thing, if I look at criminal activity, that's not listed under the advisory committee pick. Yet criminal activity is pretty much driven by poverty. It's driven by mental health sometimes. It's driven by substance abuse and alcohol abuse or addictions in general. So I kind of find it puzzling that criminal activity is not involved or it's not identified in the advisory committee's top picks. When criminal activity, when we look at our community response strategy to criminal activity, it talks about the involvement of everybody to get us from the red zone down to the green zone. So it's not, I can't see why we excluded that, the criminal activity from the advisory committee pick. Because criminal activity ties into everything that happens, or a lot of the time, it's whether it be poverty, mental health, or substance or alcohol addiction or substance abuse in uh, generally drives criminal activity, or it's driven by criminal activity.
Yeah, a lot of the elements are very interconnected, for sure. Mary, what do you think?
Um, I have to say that I agree with your suggestion about 5 and 6, but then I can see what Chief Horvat's saying too about the internet access. Elgin County have a connectivity committee, and we're working diligently on trying to bring internet up to a good standard for Elgin County. And I will admit, it's not great in Elgin County right now, but I mean, the purpose, to me, the purpose of the CSW plan is not to reinvent the wheel. It also, I don't think we should be doing duplicate things. We need to be focusing on key issues. And I believe that number 5 for sure is being addressed through the county and through other municipalities in Elgin County as well. So I'm wondering too, what Chief Horvat said about criminal activity. I'm not sure if we could fit it into something else, but I think in this case, less is more. I don't think we should overextend ourselves, because when you start doing that, it makes it difficult to even get anything accomplished. And we don't want to get to the point we have so many things we want to do. Let's do something and let's do it well. So I would say cutting down maybe to 4 picks. That's just my suggestion, Jennifer.
Okay, so let me sort of recap where we're at. So I'm hearing potentially 5, the internet access could come off the list. So I want to hear other voices on that. Are people okay if I take digital literacy as 6 and I tuck it up under education and skills development, so it becomes sort of a focus underneath that? So let's talk about, are people okay with removing internet access from the top list, knowing that it is being worked on? I saw a little nod from Julie. And anyone else give me a nod or a thumbs or a,
Jennifer, it falls into what you were saying. I think it all falls under each of those categories independently. So I think
okay.
just as separate is it's maybe a little extra noise on our goals, just blend it in.
Yeah, so are you okay if I put a little note saying it's a lens that we would apply across the priority areas? Okay, people okay with that? So that takes us to 4,
Jennifer.
and then I want to address Zonk's question around should criminal activity move over and also be one of our top priority areas. What do people think about that?
Jennifer, it's Sally.
Hi, Sally.
I was waiting from 2 o'clock on and just got in now. I'm not certain why, but I missed the first part. I'm fine with the internet piece.
Is it Sally that's unstable or me? Sally? Okay. You can never tell. Are you all moving? So Sally, you're unstable. We can't hear you. So let me go to someone else. Criminal activity. Let's talk about that. What do people think?
I mean, I agree with Zonk. Sorry.
Go ahead, Mike.
I was gonna say I agree with Zonk. I mean, everything that we deal with, generally speaking, anyone that is included or have those community issues from 1 to 4, usually we find there's some correlation between that and a criminal element that we deal with in public. So, I mean, it's part of each one of those. So I don't know. I mean, the community, are we going to attack criminal activity from a community standpoint, or are we attacking the causes that get people in?
Right. What do people think?
Well, just on top of that, criminal activity, I think, is part of community safety. If you drive down the criminal activity, and if you don't identify that in your community plan, I think we're missing the boat here, because each service, whether it be OPP, St. Thomas, or Elmer, we all have to take a look at criminal activity. We do it through focused patrols to reduce crime rates down and things like that. So I can't see how you can exclude criminal activity from your from one of your top 5 or 6 picks in this community safety and well-being plan. It just, I mean, if we look at the community, it used to be, help me out, Mike, that community, like the wheel that we have now, as far as going from a red to a green zone, that all talks about criminal activity and how you're trying to reduce through education, through partnership that you have with communities, through heavy enforcement and all of those things. You have to include criminal activity in your safety planning, because that's all part of the community safety, is reducing crime.
Joe, did you want to jump in?
Yes, I agree with that being a greater part of a community safety and well-being plan. I get that the whole internet access has a real reason for being disturbing to a lot of people who don't have it, but I like what you just suggested, that the digital literacy piece truly is a part of education and skills development. We're not defining what those skills are at this point, and so digital literacy could easily be part of it. I have, and I don't disagree with what Zonk and Mike just said. I think but I think there needs to be, I see employment or regional economy in the other 2 columns, and we don't truly in ours from a well-being have economic growth or something to that deal in ours. So I recognize that many of these things all have to do with economic growth, but if we're going to pick 1 or 2 to pull out, then that's another one I would suggest.
So let me tell you a couple of things. So Middlesex actually merged employment, education, and skills development into one category. So they took the employment element, the education and skills, and said, those are similar enough. They're sort of foundational pieces, like you said, around building an economy. So they put those as one category for their plan. So that's sort of how they wove the employment piece in. So that's an option as you think about that as well. And then the other thing around criminal activity, both other communities I'm working with do have it, but they're calling it public safety. So they're moving it away from like the negative word, which is criminal activity, and focusing more on the public safety side of it, which is, it's still the same thing. They've just decided to call it something a little bit different. Some of the other communities have also merged it with mobility safety. So things like aggressive driving, speeding, DUI, like some of the other things that might fall into a public safety kind of realm. So that's just to give you a sense of, give you some other options or ideas sort of percolating in your head around it. So I want to hear some more voices around criminal activity and or the other one around merging employment with education and skills development. Thoughts on either of those?
Jennifer, it's Wendell. I'm just wondering, not to digress from what you're asking about, but I'm just wondering about a kind of a slightly putting it under these things under a little different lens in terms of the lens of which of these would hit the highest marks in terms of serving the greatest amount of our population and the demographics across all ranges in our population that would be the highest benefit to everyone to be focusing on. As an example, I would say mental health probably touches the youngest to the oldest and everybody in between kind of thing. And if we kind of looked at some of these in that regard, some of these, the margin of the pie might be a little bit thinner in terms of who would actually touch. But if we're looking to make an impact for the greatest, is that a kind of a lens to look at some of these things through?
Yeah, and yes. And another thing that may help you is also thinking about, is there work already happening? Like, are there groups already working in some of them? So for example, your substance use and addiction, there is a group that's working on an Elgin St. Thomas alcohol and drug strategy. Like there is a group that's focused on that. There is a group that's working on a mental health and wellness strategy. So it's sort of up to you. You could pick one or two where you say those are the foundational elements we want to work on, knowing they're all interconnected and saying, okay, if we worked on this one, would it actually lower criminal activity? Would it actually help with people's mental health and well-being? So you could try to take it down to what's a foundational one that may actually give you a bigger sort of domino effect in terms of your impact. Or you can say, you know, we're going to pick 5 and we're going to do a little bit in each of them. Or you could say, Wendell said, we're going to pick one that we think will apply to a broader cross section. Like there's lots of different ways you can look at what you want to have in your plan. So any thoughts on what Wendell's suggesting and or what I just said? Hi, Carolyn.
Well, if you don't mind, I'll add to what Wendell said too. I think I asked it last week or the meeting before and said these are all, you know, fantastic and they look great. But as all of us being parts of municipalities or working for municipalities or service agencies, some of us don't have the ability to change some of these. I mean, whether it's and I agree with Wendell, mental health and well-being seems to be one of the greatest things we need to work on right now if we add addictions to that. But it's not really a municipal problem. I mean, it's a municipal problem, but it's not there's not a municipal solution. I don't have healthcare in my budget. So who are we making the plan for? And I think I asked it that way then, is if this plan is for us, great to tell other people what they have to do. But I really find in my life a lot less gets done when I'm telling other people they have to do the jobs I'm coming up with. So just to clarify that one again, these are the top picks for us or for us to do.
So to me, this is my perspective, it's a community plan. It's a community safety and well-being plan, which means municipalities will have some role in it based on what you're mandated or legislated to do in terms of your municipal role, and the community in terms of your community service providers and agencies will also have a role to play in terms of implementing it. That's what a community plan is. It's not like one actor can actually make everything happen within the plan. And that's why as we move into the next phase, which is designing the plan around what the strategies look like, we need to engage those strategic partners who will actually be implementing different pieces of the plan. So it's not just municipalities. What can municipalities do? Well, you can say, yeah, we can do A, B, C, and D, but with mental health and well-being, it's going to be different agencies that need to come together and talk about what they're actually willing to do over the next 3 years in terms of moving the plan forward. So to me, it's a shared plan with the community. And it means that as we move into actually designing the plan, we need to make sure the right people are at the table, or nothing's going to happen going forward. Because as Joe said, then you're just going to say, this is what we want as a, as municipalities. But if you don't have the people who actually have to do it at the table and buying in, it's not going to happen.
So if I may just again, if you'll indulge me, because I think Julie's on this. I can't see her, but if she's on this, sit at the Ontario Health Team table, and like as I understand it, it would be interesting to cross-reference all of the touch points of people and agencies who have had their input in this plan, and have had their input if they're in which of those have had input into the Ontario Health Team plan. That's where I'm going with that. That would be interesting to know. But as I understand it, the top issue coming out of the Ontario Health Team plan is COPD, breathing issues, etc. The second close runner-up is mental health issues. So my point is, kind of to the Mayor Joe's point, is I don't know how much we should beat ourselves up around mental health issues. We know when we know it's in the health form, it's their second priority in terms of you've got all those mental health agencies and everything who are going to be hopefully rolling something out in that whole area. And it's tough when we're kind of dealing on these two streams.
Yeah, and I did have a discussion with the consultants who is supporting the Ontario Health Team, because we were talking about, is there an opportunity to be more integrated in terms of that planning piece and then implementation moving forward? And he certainly thought going forward, once you got the COPD piece sort of in provincial approval to move forward as a team, that table could certainly be expanded to be broader, so to include more of the social determinants of health. Because again, thinking about implementation and what's the table that's going to govern your implementation of your community safety and well-being plan, knowing that you've got the Ontario Health Team who's doing similar kinds of processes around identifying what are those needs in the community. So where are we at? So I have 4, but then I've had a few voices say maybe not. Maybe it's like 1, maybe it's 2. What do you think?
Well, again, going back to the criminal activity, and I don't care what you call it. You can call it whatever. I mean, we used to have directed patrols. We changed it to focus patrols because it was softer or whatever. This whole plan is being driven by the Police Services Act. And if I look at the 4 or 5 or 6 advisory committee picks, they're all related to social problems within our community that have absolutely nothing to do with policing. I think a big part of your community safety does involve reducing crime and reducing traffic issues in your communities. And I think when this whole community safety and well-being plan was introduced, that is a big part of it. And yes, these other things such as mental health and substance abuse and education, they all can be part of that reduction in crime, but it has nothing to do with police at all. The way we have it defined right now, I can tell you right now that if this was implemented, I would say that from a policing agency perspective, I don't have anything to do with any one of these things, because they're all social problems with social disorders. So you have to include whatever you want to call it, I mean, our whole planning for our strategic direction for the 3 years is reduction of crime in our community to make it safer for the residents and communities as a whole. And all of a sudden, we don't have it mentioned at all in our top picks. So I see that as a bit of a problem from a policing perspective, anyway. I mean, on the other hand, when I look at that, if we implement that, I don't think that I would involve policing any of those. I know we respond to mental health calls for service, but I mean, the way they're talking right now, they're trying to mitigate that, and that's the whole drive about the defunding the police, take the funds away from the police and move it into some other project. But at the end of the day, I know who gets called to these things, and it's always the police. So I don't think you can exclude whatever you want to call it. I don't think you can exclude the actual crime in the community and traffic problems, because that is a big part of your community safety.
Joe.
Yeah, I agree. How would you word it? So give us number 5 then, if that's the case. What does it read like? Less crime or?
Well, I think public safety, I think Jennifer kind of hit that. It captures public safety, deals with a lot of things. It's as Zonk indicated, it's either traffic safety or criminal activity. I mean, we deal with many different facets of safety in our community. So to just tie it to a criminal element doesn't capture all that we do. So I think if you direct it as public safety, probably captures a fair bit of what we do. And as Zonk says, that now includes us in that list. Otherwise, I agree, there's nothing that out of the 4 that includes stuff that we do.
I don't disagree. So putting a line that says improve public safety or public safety certainly sounds fine to me.
Yeah, it's interesting, Zonk, as you're talking, it's like, what's the overall goal for the plan? Because then the areas of focus are sort of the levers we're going to use to get to that goal. So if the goal, and maybe that's something we need to talk about as a group, is what is that overall goal? Is it to increase feelings of safety and well-being? Is it to decrease crime in the community? Like, you want to be more specific? And then what are the ways we're going to do it? We're going to do it by focusing on mental health, housing, substance use and addiction, employment, education, skills development, public safety. Those become the levers to get to your goal. But thinking about that, like, what is your goal overall in terms of community safety and well-being? Because I mean, I heard Zonk, you hit on it, made me think about it, because you said, oh, we want to reduce crime in the community. Is that what community safety and well-being is about, your plan? What's the goal of the plan?
Well, it most certainly is. Like, I mean, if you look at, I mean, people that are involved in crime are not always part of that mental health and substance abuse problem. There's all kinds of other crimes that people are motivated to commit crime. I mean, right from gangs, organized crime, down to just a common criminal that they survive on committing crime. And they may not have any kind of issues with addictions or anything else that we're talking about from the social problem perspective. So you need to focus on those things in order to reduce crime and community safety. Because if you've got a organized crime group in your city, the police have to deal with it, and that's all part of crime reduction and community safety. You have to implement some kind of strategy to deal with that and to increase the safety of residents that potentially are living within that vicinity of that organized crime group.
Let's get some other ideas. What's the goal? What would be different because you have a community safety and well-being plan?
I don't know if you can see my hand, Jennifer,
Oh,
but
sorry, no, go ahead.
I think an overall goal of the plan is to integrate systems and planning that's taking place in the community.
Interesting, yeah. But what's the goal of that? Why would you integrate systems and planning? What's the hope for that? Is it like a seamless
Better use
service
of resources.
experience? Like, is it an integrated service experience for people? Like, what's the goal of integrated systems and planning?
There wouldn't be duplication. There wouldn't be wasted time. You know, everybody would be on the same page, and the patient wouldn't have to, or whoever it is, and I don't mean patient, but the person would, you know, everything would be coordinated and make sense to them. It wouldn't be one person telling them one thing and someone else telling them another.
Yeah. Other ideas? What's your goal? Why the plan?
Yeah, I would agree with Mayor Martin in that it's sort of an index of all of your resources that are available. It's the roadmap, and it's you know, the purpose of it is to be able to, you know, deliver these, I guess, to meet goals more efficiently.
Other goals for the plan? Why would you have a plan of community safety and well-being?
Well, I think simply put as well, it's going to articulate who does what, who's on first base when a certain issue comes up. So that people know this is the resource to go to this spot.
Will help so that no one falls through the cracks, we would hope.
Are there any other goals for the plan? So thinking of those goals, what do we need to focus on in the plan to get to those goals? To me, it's interesting. Some of the goals you've identified are actually more process system goals versus topic goals, like subjects. Like, it's not mental health and well-being. It's not necessarily criminal activity or housing security, but you've got a lot of stuff around organizations working together. So it's interesting as you're talking about that, maybe one of the priority areas is actually something around integration of services. Or integration of service system planning. Not just sort of these topics that you have or subject areas that you have. Thoughts on that?
I think that's, for me, sorry, Jennifer, I hope you're able to hear me.
Yes.
That's, to me, the whole basis of this is to get us working together. So, you know, no one's duplicating things, etc. I think that, to me, is the primary goal of the whole community and safety well-being plan.
So there's something like that. Not sure if that's the right language, but there's something around that integration of service system planning.
Jennifer?
Yes, right.
I think what we're trying to say is there needs to be more collaboration.
Yeah.
Elgin County is a big county. Of course, we have the city of St. Thomas, the town of Aylmer, and other rural communities. So we've got to have something that we all feel comfortable with, that we know that all our residents can find the information that they need. Right now, I feel like it's in silos. Even in the town of Aylmer, I feel like I'm dealing with something all by myself, even though I know I've got Elgin County and St. Thomas and other people and communities that can help in Aylmer. And when I speak for me and say it's me, I mean the town of Aylmer, but I still feel like we're working in a silo. And you know what? People are wasting their time. People are falling through the cracks. And unfortunately, and that is a matter of fact, and Joe knows that, I know that, the police know that. And there's got to be a way that we can do this so that people aren't falling through the cracks and we're all working together for the common good of our entire county. So I don't know how we're going to do that, but that's my take on it. That's why I believe in this CSW plan. And that's what I'm hoping to see out of it, that there's more collaboration, more communication, and we need to have those services available to everyone in Elgin County.
And I don't disagree with what Mary just said, but we have those services available now, and I feel the same as you, Mary. Whether it's Canadian Mental Health that does a very good job on 80% of its goal, unless you're one of the 20%. Addictions Ontario or Addictions Thames Valley does a very good job on addiction services. Well, I could handhold them and take them downtown St. Thomas and perhaps even downtown Elmer and show them, if you're on the street, you might see this, and these are people who need your help right now too, right? So it's not that we don't have it, it's that we're not applying it to the largest need, if you will. We have a street level need in both of our communities, and truly, I would guess across the county. And we need to be able to make sure that although the services are in place and they're very adequate, they might be adequately funded, I'll put it that way, but they're very good at what they do. We need to be able to apply that Band-Aid to the wound. And what's happening right now is we're not. So, which is why I said, I can't tell them what to do. They don't work for the municipality of Elmer or the municipality of St. Thomas. I can suggest that Canadian Mental Health has a role to play, or Addictions Ontario has a role to play, or even I can suggest to my police chief different roles that the police services could play, and it might help, but it's still not a directed resource. We're independent that way.
So what do people think about something like that as a priority in the plan? Something around the integration, the collaboration, the working together for the good of the entire county. I mean, it's interesting. That's always my question. When you even look at your the five sort of subject areas, is we tend to look at them as standalone silos, but really they all link together. So where's the spot where we talk about housing, substance use, mental health, education, all at the same table, because they all should be working together that way as well.
I'm probably talking too much, but if you put your number 6 and said underneath it to accomplish, and then listed 1 through 5, you actually get the plan, right? Because it is about ensuring we have the ability to solve each of those issues when they occur. It is not about working on each one of them independently as we see them. They should already be in an integrated service planning and collaboration, working together for the entire good of the county. And that's true, right? So by doing that, you get the 5.
Right. It's like, this is the approach to how you will focus on these. Does that make sense?
Yes, and that's what I was trying to say as well.
Yeah. Okay, so let me just make a little note. The approach is that, and then you're going to focus on these things, focusing on.
I just have a couple of thoughts about the approach.
Mm-hmm.
So integration of service system planning for, let's say, a proactive, balanced, and collaborative response. And then the focus areas.
Integration of service system planning for proactive, balanced, and collaborative response to. What do people think of that? It's interesting because as you're talking, my head's already going to structure. It means you wouldn't have necessarily separate tables working on this. You'd have an integrated table, or somehow you'd need to create an integrated table that maybe had the subtables, but everyone came up and worked together. But it starts to get to how do you structure. Is that what you're thinking about for your plan? People are mulling.
Yes, I think
Sally thinks yes. What do other people think? Just so you know, if you're going to say yes, I'm going to ask you next then how we go to actually designing what that looks like in your plan. And, oh no, I'll just put that in your head for a minute. So what do people, I've got an end, but I'll hold on to it for a second. What do people think about that? Is that the focus of the plan? I like how you added this introductory piece. I think that's an important piece. So it's not like you're saying we're just going to continue what we've always been doing, where we have a strategy over here and something over there, and someone's working on this, but it's really more about how do we all bring everything together and start to look at it in a more integrated way, which sort of goes to what Zonk and a bunch of you were saying earlier, is everything, it's connected. So how do we not continue to pull them apart into their separate little pieces, but begin to look at it in a more holistic and integrated way? Joe, you want to say something?
Yeah, I mean, I like this better than where we were, because it is about the whole county working together on all of them. As Zonk had said before, look, if crime is your issue, then a collaborative effort to deal with these 5 probably does lower crime also. It does probably help with policing from a mental health point of view, and addictions and a number of other things. If you have a mental health crisis situation or an addiction situation that is at crisis level in our communities or county, then that they would be integrated. I mean, obviously there's more than one of these that helps that. I like this layout better. I'm still not happy with, well, I'm at the point of, yeah, we've got it on paper now. Who does it? So
That's a good question. That's going to be my next question. Wendell, what do you think?
Well, I'm just thinking this through a little bit. I'm just throwing this on the table. I wonder if that first sentence could be beefed up with around what I'm about to say, and that is that it's an integration of the system, but it's also about leveraging resources to make these things happen somehow.
Yeah.
And when I say leveraging resources, that's not only the local resources, but if we all have to go to bat to leverage some other level of government to get us more resources, we should be doing it together.
Yeah.
Well, I agree. I mean, just take them. How many on here are actually provincial responsibilities?
Mm-hmm.
All right. And so you're right. We want our community to have all these things, but we don't really control that destiny, because healthcare is a provincial responsibility. Substance use and addiction is a provincial responsibility. Education and skills development truly is a provincial responsibility. And I suppose housing security and public safety fall under municipalities and the province. So if we're writing a plan for the Ontario government, I should like them at the table.
So to me, it's you have provincial resources locally, and it's how you use those resources. So even though the province is resourcing, even if you don't get more resources, to me, it's as a local system, how are you thinking about how those resources are actually being used in your community? Because maybe if you look at it in a more integrated way, they should be being used differently than how you're using them today. And well, I know it's hard, because getting certain sectors to loosen up how they use their money can be a difficult discussion.
Let me just kind of give you a bit of a really quick analogy. And when we began this COVID experience, as other communities in Elgin did, we certainly had the big issue of people who were living life hard on the streets and nothing available to them. And somehow or another, I got drawn into a working group of addiction services. And there must have been 20 or 30 people and agencies on that thing. And they're all talking it, but nobody's doing anything. There's no cohesion of anybody putting up their hand and saying, I'm coming to the street to deal with X, Y, Z. And that is so frustrating because they're all getting a big bucket of money from someplace to do whatever they're supposed to do. And they all have their own little widget mandates, but nobody's focusing on these real big issues because everybody thinks somebody else is doing it. And that's the frustrating part.
Yeah.
Or truly, they're doing a great job on the things they are working on. There's a fantastic substance abuse website. There's great, products available. But the guy living in the dumpster behind downtown St. Thomas isn't on the website or getting any of these documents. So I agree with Wendell, they're getting the connection here. And even with full being, I will admit to being shy and not always saying what I think, there was no movement during this whole time of COVID for them to come help. It was, yeah, we're doing this instead. Thank you very much for your opinion. All right. So no offense, that they were doing great work, but we pointed out where more need was under mental health and addictions, and it's very hard to get the collaboration. So nice that we're putting it here, right? That we will get collaboration somehow, right? But we're riding the bus too, not driving it.
So as you're talking, this is what I'm thinking. So you have big issues in each of these areas. So if I think to the, back to the general public survey where people said, oh, this would be substance use addiction. It'd also be under public safety. I'm afraid to go downtown St. Thomas because I see people on the streets. I see needles discarded on the streets. So that's to me, that's a big issue or complex issue that requires an integrated solution. So what I would see is that in each of these areas, the 5, you may have big complex issues like that. Another one would be lack of affordable rental housing, big issue everywhere. So then, but instead of just the housing people sitting around the table and saying, what are we going to do about lack of affordable rental housing? You'd have this table of all of these heads that would say, what's all of our role? If that's the big complex issue, we need an integrated solution that looks beyond our sector. How do we all address people on the streets, downtown St. Thomas, not safe, discarded needles? What's my role for mental health? It's looking for those integrated solutions versus just a housing solution or just a crime solution or just an education solution. That, to me, that's how you would actually begin to move stuff forward, is instead of these tables looking at issues, you'd have an integrated table start to think about how they could do it differently. That's how I'd sort of see what you're setting up look like. What do people think about that?
I think so.
I would agree with that, Jennifer. And I think we need like a one call or one location where you can actually, they can quickly access the groups that would be needed to help with that particular problem, whatever it is. And that they know, that they can refer people to the right places or refer the right groups to the right people. And somehow we need one location, I think, that does all the coordinating if it's going to work.
To me, it's sort of like your situation table, but your situation table is very focused on certain issues versus broader issues. It's like your big integrated situation table where you bring your complex issues and actually work on them.
And I think too that, whether you're sitting in Vienna or Dutton or Belmont or Elmer or the city, that all of these things mean exactly the same thing, that those resources are available and those buckets are available,
right,
to the same level and degree.
Yeah. See, I would almost take this to that. Integration of service system planning and leveraging resources for a proactive, balanced, and collaborative response to big complex issues that require an integrated, I'm not sure integrated solution is right, but integrated solution. Focusing on And then what your plan could do is, based on all of the data we've collected through the engagement surveys, is actually identify right now what those big complex issues are. Because we've got a lot of information of people telling us what they think they are. Because then your plan could map out a 3-year strategy to say, if we had like one item in each, like the top thing to be worked on, that's what you'd work on over the next 3 years. This is like we went off like in way left field over on this one. How are people feeling about this? Mary, what do you think?
Well, I think we're getting there, Jennifer, but Joe's not here. I think he's gone to his other meeting, but I'm really not that shy. And I'm going to be a bit opinionated, but the problem is a lot of this stuff is being covered. And yes, we do have lots of groups that work together all the time. This has been going on for years in Elgin County. The problem is we all go to the meetings, including myself, but what do we do? What do we do with that information when we leave? Are we actually taking action? We talk about it, we make plans, we know there's a problem, we acknowledge it, but what do we do about it? So I want us to come out of this with a plan that's going to work so that we're not spinning our wheels. Because we all are busy people, including all the different agencies that we're going to be talking to or have talked to. They're all busy people. And yes, they do a good job. But the problem is, we just need to be focusing more as a group, understanding what each other's doing, and then we actually have to take action. That's my point. I'm not sure how we do that, but I'm just saying we've really got to see some action coming out of all these plans.
So I guess my question would be, what's going to make that happen? So if it hasn't happened in the past, like what are the things that are holding it back? Like what are the barriers or the challenges to actually moving stuff forward and into action? Josh, did you want to say something? You're off mute. Or you look like you're off mute.
No, I didn't have anything top of mind there. No.
Okay. I always
So
pick
I'm
anyone who
just
goes
gonna,
off mute. I know.
I'm just gonna reinforce what Mary just said, and I think she's hit it right on. It's like, okay, what are the gonna be the priority commitments under each one of these that everyone's gonna stand on the plate and say, we're gonna make this happen. This isn't just gonna be something that we're gonna look at in 3 years and say, oh, wasn't that a nice thing? What are the commitments that we are all gonna agree on that are gonna make this stuff happen? Tangible things.
I think one thing that goes hand in hand with what Wendell just mentioned is some sort of an asset inventory. So by asset, I mean, what does that community organization do, and what funding do they receive? What are their current, kind of what's their current scope or responsibilities for responding to that bucket or lever that we're discussing? And if we link that back to how this plan is intended to integrate and almost impose collaboration among community organizations, then I think it's important to know who does what. And if we clarified that under each of these buckets, that would go a long way to identifying roles and responsibilities and actually getting us to a place where we could see some action.
Yeah, so I'm seeing a couple of things. We could take the 5 and go through the data and say, these are the sort of the top things we're seeing, and get then a priority commitment in each of the areas. And then also do that asset inventory and map it to an asset inventory in terms of what's already happening. There's going to be some good next steps around that. Other thoughts? How are you feeling about this sort of as an approach? So what it would mean, so I'm trying to get myself clear in terms of like concrete next steps, what it would look like. Would it be me going through sort of what we've heard and sort of identifying under each of the 5 what were sort of the top things we heard that should be a focus? So like the top issues that have sort of emerged before we get to this. So identify top issues in each area, and then priority commitment. And then as well, at the same time, we could do that asset inventory to find out what's already happening. What would you see? So if these are the 5 and you want to move towards an integrated approach, this piece here, identifying a priority commitment, how would you see that happening? Like, would you see us bringing together then sort of an integrated table of all of these players to say, here's what we've identified as the top issues. Help us identify what you think is a priority commitment for the next 3 years. Because it becomes, who's the group that does this, right? Knowing you want to get that buy-in and ownership to move it, to continue to move it forward.
Jennifer, I just want to come back to your earlier point. So in all of the information and the community input that, that has been collected so far, would you be able to develop 2 or 3 bullet points under each one of those things in terms of what people were saying? And then that helps lead us to how do we develop a commitment for each one if we know what those priority bullet points are.
Yeah. So why don't I do that? So I'm going to maybe suggest that I do that and you mull about this approach. So reflect on it, take some time. And what I'll do is I will take those 5, I will put sort of the top issues that we've heard through the engagement strategy underneath them, and I'll start that asset inventory as well so that we have those pieces. And then why don't we come back and take a look at that and then sort of think about how you want to move it forward. So that sort of be your homework, is sort of make sure you're feeling okay about this. I'll send this out so you can take a look at it. And then start to think about what's the structure to actually continue to move it forward. So to me, there'd be a couple of things you'd want to think about. You'd want to think about how would we sort of take the top 5 issues, the top 5 areas with the issues, and identify the priority commitment. So what would that sort of process look like? And then think about on an ongoing basis, once the plan is done and you're going to move it to implementation, what's the governance structure then? So you're going to need some kind of integrated governance table. Is it the Ontario Health Team? Is it another table? You used to have that community leaders cabinet. So think about what's that implementation piece, because you're going to need that integration sort of as a governance piece to continue to move it forward if this is the approach you want to take. Thoughts on that? Does that sound okay for sort of homework and to keep it moving forward? Julie, what do you think?
I think it's great. I just have one thing to add, and I think I mentioned it at the last meeting as well, but it's circling back to what Mayor Preston keeps reinforcing, which is, while municipalities have to approve this plan, all community agencies will have to endorse this plan. So I think we'll want to think about what that process looks like as well.
Yeah, as when you said priority commitment, Wendell, you got me thinking about, do we get actually letters of commitment from community service providers that they're committed to moving forward with the issues? There's something around that endorsement commitment. Question.
Yeah, Jennifer, when I think of commitment, I'm thinking of like a specific action item.
Yeah.
So not so much, and then then we're going to tag that to somebody or someplace to do it. It's an actual action item, achievable goal with a timeline on it.
Okay, so if we do the top issues, then we identify priority issue with commitment for action. For actions. Yeah, I could see it where, let's say mental health, these are the issues, they pick this as sort of their priority issue, then we build the action plan for the next 3 years and people sign off and put their names in terms of leads and actions beside it. So it builds out into an action plan. Well, this wasn't where I thought we were going today, but it's really good. I love discussions. So I'm going to take that slide and I'll put it onto a Word document. I will send it out to you so you can reflect on it. And as I said, continue to think sort of about the process for the next step, which would be how do we get from sort of the top issues in each area to identifying what we want to focus on in the plan. So what would be the process? Who should be involved in that? And also start to think a little bit about the governance structure, sort of beyond designing the plan, but as we move into implementation. Okay.
Jennifer, it's Sally.
Hmm?
Can you hear me?
I can.
I don't know what happened. I don't know what happened at the beginning. I was waiting from about 2 minutes to 2 and it didn't even let me in until 2:14. And then you couldn't hear me or whatever. So I'm not certain it now is working. I turned video off to give me a stronger audio, but I'm not sure what happened.
Yeah, no, you're good
Just
now.
apologize.
Oh, no problem. Thanks for coming, Sally. Any other final sort of thoughts, comments, questions? No? Okay, I think that was a good discussion today. I think it's moved it further along, which is good in terms of starting to think about what it might look like. So I'll send it out to you for some reflection. And do we want to set a date now or do you want to wait for a doodle? Sally, you're nodding. Does that mean doodle or now? People?
I'm nodding.
Thanks, Sally.
I'd rather set it now.